Welcome to Sex Re-Education. First, let's talk about what sexually transmitted infections actually are. STIs are viral or bacterial infections that spread from one person to another, usually during vaginal, anal, and oral sex. They're very common, and lots of people who have them don't have any symptoms. STIs can even be transmitted from mother to baby during birth. In 2018, college-age students accounted for 65% of chlamydia cases and 53% of gonorrhea cases in the United States. People ages 15 to 24 account for 42% of HPV infections yearly. Now let's review some common STIs, prevention, signs and symptoms, and treatment options. First, we have bacterial infections. These are typically curable through medications. However, you can become reinfected again. The most common bacterial STI is chlamydia. Other bacterial STIs include gonorrhea and syphilis. Well, how are these prevented? Prevention includes abstinence, proper condom use, and regular screening if sexually active. Now note that proper condom use reduces the risk of syphilis but may not prevent transmission. Chlamydia and gonorrhea are transmitted through vaginal and penile secretions. However, syphilis transmission typically occurs through direct contact with an active infected sore during sex. Let's talk about the signs and symptoms of chlamydia and gonorrhea. Females can experience a thick yellow or green discharge with gonorrhea, while chlamydia can cause a thick yellow discharge with a strong odor. Both of these can cause abdominal pain, pelvic pain, and bleeding between periods. In males, gonorrhea can present with a serous or blood-tinged penile discharge, while chlamydia can present with a mucoid or watery penile discharge. Males may also experience unilateral testicular pain and tenderness. Infection may also lead to inflammation of the prostate, causing painful urination, urinary dysfunction, pain with ejaculation, and pelvic pain. Both sexes may experience painful urination, conjunctivitis if there's direct contact with the eye, and rectal infection, in which men who have sex with men are more at risk. Signs and symptoms of syphilis are a bit different as compared to chlamydia and gonorrhea. These symptoms depend on the stage of infection. In stage 1, or the primary stage, either sex may present with painless genital ulcers. The secondary stage can present with a rash over the trunk and extremities, including the palms of hands and soles of feet. Without treatment, syphilis can progress to stage 3, leading to weakness and even paralysis. Many people have no symptoms, so they're unaware they may carry a bacterial STI. Untreated chlamydia, gonorrhea, or syphilis can advance to pelvic inflammatory disease, which causes scarring of the fallopian tubes in females. Untreated in males may lead to epididymitis, where the infection travels to the epididymis in the scrotum. Unfortunately, untreated pelvic inflammatory disease and epididymitis can lead to infertility. Antibiotics are used to treat all bacterial infections. However, there is a growing resistance to antibiotics with gonorrhea. Next up is the protozoan organism Trichomoniasis. Prevention remains the same as with bacterial STIs. Abstinence, proper condom use, and screening when sexually active. However, transmission occurs through direct contact with infected mucosa rather than secretions or active infected sores. Acute signs and symptoms of trichomoniasis in females include a frothy, malodorous, thin vaginal discharge with burning, itching, painful urination, frequency, lower abdominal pain, and/or pain with sex. Males may have a clear or yellow penile discharge, pain with urination, mild itching, or a burning sensation after sex. Females with chronic infections may experience itching with sex, pain with sex, and scanty vaginal discharge. Trichomoniasis infection has also been associated with prostate cancer in men. Like bacterial STIs, infertility can occur in either sex if left untreated. Again, antibiotics are used to treat this type of infection. Next up are viral sexually transmitted infections. Viral STIs don't have a pharmacologic cure. However, there are medications that can manage the disease. But this does mean that you will always continue to have the infection for the rest of life. First, let's talk about herpes simplex virus 1 and 2 and human papillomavirus. For both HSV and HPV, prevention includes abstinence. And although condoms do not prevent infection, they may reduce the risk of transmission for either virus. Regular screening while sexually active is recommended as well. Prevention of HSV 1 and 2 also includes avoiding sharing drinks, food, and kissing. Vaccination is also available to prevent HPV. HSV 1 and 2 are transmitted through skin-to-skin contact with infected areas, saliva through kissing and sharing drinks, and oral, anal, and/or vaginal sex. HPV is transmitted through direct skin-to-skin contact as well as vaginal, anal, or oral sex. Next, we have symptoms of HSV 1 and 2. In either sex, a person may have no symptoms, but if they do, it can occur with oral and/or genital blisters. These lesions are typically painful. Either virus can infect the mouth and/or genitalia. Primary infection can cause fever, headache, and muscle pain. HSV can also infect the eye and cause blindness if not treated. Severe infections can cause encephalitis, which is inflammation of the brain, and can even cause inflammation of membrane layers that protect the brain, or meningitis. HSV can also cause facial paralysis, known as Bell's palsy. Antivirals are used to treat HSV 1 and 2, but as stated before, a person will always have the infection, and the lesions and blisters may occur again during a lifetime. You can even spread the virus even without exhibiting symptoms. Let's move on to HPV. In both sexes, HPV may be asymptomatic, or they can cause genital warts, lumps, and/or sores. HPV strands 16 and 18 can cause cervical, anal, vaginal, penile, head, neck, and throat cancer. HPV infections will be cleared out by the body's immune system. However, there is no treatment. Vaccination is the best way to prevent cancer caused by HPV 16 and 18. In the decade following introduction of the vaccine, prevalence of cancer-associated HPV decreased significantly among females aged 14 to 24. Lastly, let's go over human immunodeficiency virus and acquired immunodeficiency syndrome, also known as HIV and AIDS. HIV is a virus that attacks the body's immune system. By doing this, HIV weakens the immune system and prevents our bodies from fighting off other infections. Untreated HIV can lead to AIDS, which is the late stage of HIV and can lead to death. HIV can be transmitted through blood, semen, pre-semen, rectal fluids, and vaginal fluids during oral, anal, or vaginal sex. It can also be transmitted through blood during a transfusion or by sharing needles or syringes. And it can even be transmitted through pregnancy and breast milk. Preventing HIV infection includes abstinence, condoms, screening when sexually active, and PrEP and PEP therapy. Pre-exposure prophylaxis, or PrEP, is medicine that an individual can take to minimize their risk of contracting HIV. When taken correctly, it is highly effective. Post-exposure prophylaxis, or PEP, means taking medication to prevent HIV after a possible exposure. Symptoms of acute or primary infection include fever, fatigue, muscle aches, sore throat, rash, nausea, diarrhea, and headaches. Later stages of HIV present with opportunistic infections. These are pathogens that don't typically cause disease in a HIV-negative person, but take advantage of the lowered immune system. These infections include candidiasis, a fungal infection of the mouth or esophagus, hepatitis, a liver infection, and pneumonia. Viral load is the amount of HIV in the blood. The higher someone's viral load, the more likely that person is to transmit HIV. Taking antivirals lowers viral load to undetectable levels. This helps to reduce transmission to others, and it also helps to reduce the risk of opportunistic infections in a person positive for HIV. Although there is no treatment, HIV can be managed and many people live long, happy lives and protect their partner. Let's wrap up with a quick review of what we've learned about STI prevention. Abstinence is the only method to prevent STIs that's 100% effective. However, if you are sexually active, there are other ways to prevent transmission to yourself and others. There are vaccines to prevent HPV and hepatitis B. Correct condom use will prevent HIV, chlamydia, gonorrhea, and trichomoniasis transmission, and reduce the risk of herpes, syphilis, and HPV transmission. Annual screening and screening before having sex with a new partner will decrease the risk of transmitting to others. Remember, most people don't show signs or symptoms for many of these STIs. And last, PrEP and PEP therapy can help to prevent HIV transmission. Here are some tips for good sex hygiene.